Dave, thanks for joining me. You're one of my close patients now, but back when I was working in Utah, you were a general surgeon at the hospital where I came in and started working.
Yeah,
you were working
we
there
first
before.
met there.
And we were never like super close friends, but we were working together and
Yep.
and got to know each other there. And then I came down to Arizona. You later moved down to Arizona and
Yep. Retired here to be close to kids. Yep.
started seeing me as your doctor. And
Yes.
we started treatment last year.
Yes, we did.
So I love your story. You've obviously had some knees done.
Oh, yes.
That's a huge
I'm bilateral titanium.
a huge side effect complication of obesity. Fatty liver,
Yep.
sleep apnea,
Yep.
prediabetes, hypertension, just the usual stuff that,
All the above.
that we've been seeing every day for our whole careers, and thinking there was no cure for it. You
Well,
just take a medicine for each thing,
Yeah.
and
And
just
trying to figure
carry
out
on.
how to address it.
Right.
And that grouping of stuff, combined with genetics, family history, lifestyle, how you approach, how you live your life, it all has effects.
Yeah.
Yeah. And it was I'm sure part of this is a genetic issue for me. I've got lots of family history of obesity and diabetes and heart disease and arthritis and all the above. Both of my folks had knee replacements reasonably early in life, right? So there's some of that is all there. And I have struggled with weight and weight control essentially most of my life. There was a session in my late teens and early 20s where it wasn't that much of a thing. But after that, after say age 25, 30, it's a real challenge, a real struggle. And no matter what I did, that progression of more weight, heavier every year was something that was hard to fight.
So I'm going to spill the beans really quick.
Okay, you're
on
good.
On your starting point and your ending point now. We'll talk about your story a little bit more.
Okay.
Your highest weight here before you started treatment was 229 pounds.
Okay.
Was that your highest weight ever?
No, my highest ever was about 240.
240. Okay, so you
At
got
about 5.5 feet tall.
Okay. And now down to 193.
Yep, and even less. 190 this morning. How about that?
Okay. New numbers. Okay, look at this. Your body fat mass, the pounds of body fat, 65 pounds starting and 36.9 ending without the new numbers.
Yeah, yeah.
That's 43% of your body fat in mass lost. And then muscle mass, and you can see it, started at 76%, ended at 76 pounds, ended at 73 pounds. So you've lost 4% of that initial skeletal muscle mass. And your visceral fat has come down to normal.
Yeah.
From 3 times normal.
Yep. It's been pretty amazing.
Your fatty liver is gone on our last ultrasound.
Yep. Also true.
And there's other things that I think if we were able to treat obesity from an early age that you never would have gotten, sleep apnea. And who knows what would have happened with your arthritis, but
Oh, it certainly would have been slowed, I'm sure.
you spent years in the operating room with that extra weight leaning over into the operating field too, and the stress and
coming from the medical field, you know the drill. Medicine is a high stress life. It's a high stress. It's an anti-healthy lifestyle in many ways, right? And general surgery, which I was involved in, has that in spades. So sleep is almost always interrupted. lots of night work, lots of weekend work, grabbing meals when you can, mostly hospital food that you get on the fly, and making life and death decisions for people on a regular basis. Those are all high stress, high consequence things. And I think that for a lot of us in the medical field, our own health and our own progress gets put on the back burner because we have other things to do, right? You can't sit around and wait to get your workout in if you've got a ruptured appendix that has to go to the operating room right now.
Yep.
Yeah, and so those things in conjunction all together just really are, it's a pretty toxic mix when you think about it. So now that I'm sleeping better, certainly eating better, getting more physical exercise, and the benefit of nutrition help and a GLP-1 have been like the secret sauce. It's really been quite amazing to me. And you and I have talked about this before, but once I started on the GLP-1, the constant noise about food in my head went from 80 or 90 to like 5 or 10. It was amazing, the difference it made. I've told you this a couple times, I think, that I would hear people say, oh, I got busy today and I missed lunch. And I'd think, that's bull. I've never missed a meal in my life. In fact, sometimes I eat 2 meals just because I might be afraid I might miss one down the road. Right?
No matter how busy you were.
It didn't matter. I'd grab whatever was handy. And that's part of the problem, because usually the stuff lying around is awful. Right? There's very little nutritional value in it at all, but it's a little something to nibble on. And so having that disappear, and I've actually had days now where I've gotten involved in something, working on a project at the house, reading a great book, whatever it is, and missed a meal and not even thought about it and said, oh, wait, I got to jump on here. It's 3 o'clock and I haven't had lunch yet. And that difference has been mind-blowing to me. I didn't think those people were telling the truth, and I think it's true. Those skinny people
there are people who
don't have the same problem that I had with that constant food noise.
Sometimes they have to think to eat.
Yes.
Set a timer or whatever.
And I do that now. I've got a schedule. I've got so many calories, and I'm sort of OCD about it because I'm weighing and measuring and doing all this stuff to make sure I have the right levels of proteins and fats and carbs and vitamins and fiber, et cetera, in the course of a day. And I have a schedule that I need to keep on. And that's how I do it. I don't do it by hunger anymore. I do it by time of the day.
The key point there is that hunger back before you did treatment was a biological signal.
Yes.
You couldn't tell your body to turn that off, right?
Well, had I been able to, I certainly would have wanted to, but I could not do that myself.
And how
no matter how much I went to the gym or how great a nutrition plan I put together for the day, that food noise, that food drive was always there.
And how hard would it have been to ignore it?
I don't think I could have. I've never done that successfully on my own.
A high education level.
Oh, it doesn't matter.
High motivation.
Right. It's not like I'm an undisciplined, unmotivated guy, right? I know how to do hard things, right? I made it through 6 years of surgery residency. I made it through med school. I've done all these difficult
and your whole career.
Processes, but I could not manage that. I could not get that food noise under control until we started with this medicine. And then once the GLP-1 kicked in, it just went. It just disappeared. It was like magic.
The coolest thing about your treatment is that if we think about your medical condition aside from your weight loss, the improvement in your medical conditions is the best thing about your treatment.
Oh, absolutely.
I mean, we have some scare factors with your heart.
Yeah. Well,
right?
I've got horrible family history of heart disease and diabetes and obesity and all the other sequelae.
We're trying to prevent this heart attack from happening anytime.
Right.
And we found out that you had a a fair bit of blockage in all of the arteries of your heart.
Yep.
And as far as we can tell, that's holding steady with what you're doing.
Yeah. Yeah. And I have.
And it's not just the GLP-1 for that, but that's
No.
a huge factor.
No, but I think it's a big deal because having not the burden, or having the burden absent of carrying around all that extra weight of, what is it now, 40, 45 pounds, something like that, total that we've dropped, makes everything better. I move better, I breathe better, my workouts at the gym are better, clothes fit better, I move better, I sleep better.
You're talking quality of life, every parameter
everything about
related to that.
Yes, is all improved. Because I'm not hauling around an extra 40 pounds every time I move. Every time I breathe, every time I get out of a chair, every time I do a workout at the gym, I don't carry that with me.
And that's what matters to you and other patients. And I think that's the most important. But I think about preventing that heart attack in 5 years.
Oh, absolutely.
Preventing liver damage that has to get some crazy treatment.
Right.
Preventing
blood pressure, stroke, heart attack, arthritic changes, mobility problems, cognition, all the things that go along with being heavier is better. And life overall is a lot better if you're not carrying around all the extra weight.
And there's people who don't even lose that much weight, and they're still reducing their risk of heart attack and stroke.
Yeah.
And they're still treating their liver disease.
Oh, yeah.
So there's non-responders, so to speak, who don't have that weight loss, but they still modify the disease that they have because of the obesity.
Yeah.
And that's actually amazing. But it's great to have both, right?
Oh,
you have the weight loss, now you're moving great in the gym.
It's
you're lowering your heart attack risk.
It's made a huge amount of difference. And for me, I think the other thing that's really been amazing is the amount of increased confidence in myself. I can do hard things. I can manage this. This is something that I now have a handle on. And that spreads to other parts of life as well. It gives you confidence to try new things. It gives you confidence to learn new things, interact in new ways, improve relationships, improve the way that you communicate. All those things, I think, are affected by those mental changes that happen as a result of eating better, sleeping better, moving better, feeling better. It's really been amazing.
We need to think about that more too. Like that, the quality of life related to that is immeasurable.
Oh yes, absolutely. It's hard to put a number on it. I mean, you know, it's easy to say, well, look, your blood pressure's better.
How much money is that worth?
Your diabetes is, well, precisely, right? How much money, how much would you pay someone for a magic pill that gave you all these great things? A lot, right? So that as a part of the total package, I think has really been the magic thing. Because it was like the final piece of the puzzle that I didn't have, put in the GLP-1 in place. Now the nutrition was easier, now the gym stuff was easier, sleeping was better, all the things that went along with that got better.
Yeah. And from my point of view, we're treating so much disease in you right now that's totally under control. And previously it wasn't.
Yes. Yes. Oh, it's absolutely right.
Crazy to me.
To me, it's been miraculous. It really has. And it's still getting better, right? We're still in the process, right?
Yeah.
And it's a great thing to be a part of.
There was an analysis.
I sing your praises all the time. Whoever will listen to me, I chat with them about it all the time.
You don't have to say my name anywhere. It's okay.
Oh, absolutely, I do.
There's an analysis done on the quality associated life years gained with obesity treatment, and it's staggering.
Oh, yeah.
it truly adds to the quality of life factors, and it adds to longevity. I mean, this treatment, medicine, diet, exercise, whatever we're going to use for treatment, is helping people live longer and better.
Yes.
So
not only do you get more years, but those years are improved. Because the things you can do, the memories you can build, the family things you can do together,
yeah,
that's hugely valuable to me. And I think it is to other people as well.
I've got patients that are in wheelchairs and are able to get out of their wheelchairs now and go to the zoo with their families.
Yeah.
Or go out to a restaurant and previously stuck at home,
Yeah.
not able to go anywhere.
You can easily be homebound
Yeah.
with joint pain, with obesity issues,
Yeah.
with embarrassment. I don't want to go out. I don't want people to see me. I don't have anything to wear. I don't look good. All the excuses we come up with not to do it.
Yeah.
Yeah. So I think it's hugely beneficial, and it's work, but to me it's work that is enjoyable and rewarding.
Yeah.
It's like reading a great book, right? It's hard to get through it. You got to focus on it. But when you're done, you're like, that was great. What a great set of ideas I've learned about. I think the same thing applies.
And you're killing it too with your exercise, with your diet. I mean, you're really nailing it.
It is so enjoyable. Every day I get up and it's like, okay, what success am I going to have today? And I didn't used to have that thought.
Yeah.
Right? Planning out meals, food prepping, working at the gym, teaching classes, all the kinds of things that I do in the course of a day. It just makes it great. Life is a good thing if you feel like you're heading down the path that works for you. And this has clearly been that for me.
Well, I'm blessed to have you in my practice, honestly.
I'm grateful
I mean,
that I found you, and I'm grateful that we got each
It's
other.
amazing to be on this side of things, and it's amazing to be on that side of things, Life is
look,
great.
I view it as a partnership. You and me. And it's working.
Yeah.
I'm cheering, buddy. I sing your praises every time somebody asks a question. Let me tell you about it. I think they're getting tired of me.
Focus on the treatment.
Yes, that combination.
I want you to sing the praises of treating obesity.
Yes.
And the benefits of doing that, because lots of people don't get it.
Well, here's the challenging part. I think lots of people they say they want it, but when you line up all the things that have to happen, it's work. And most of us would like to have the benefit without the work. And that's not going to happen. But this process, adding in the GLP-1, made it so much easier to do the work. It's like the job got lighter.
My interpretation.
It's like the difference between walking a trail and riding a bike on the trail, right? One is much more efficient as far as covering distance goes and much more enjoyable, right? The other one works, but it's harder. And to me, it's like this amazing advantage that you get.
Well, my interpretation is that the medication modifies the disease and allows the diet and exercise to actually
work. Yes.
Yeah,
yes,
because
absolutely right.
Otherwise you wouldn't achieve those things. You'd still have fatty liver.
Yes. Oh, I'm sure.
And actually the risk of heart attack is pretty significant.
Yes.
With what we found in there.
Yes. All those things are true.
And you can't do that if you've progressed this far. You can't do that without medication.
I think that's, for
to
me,
some degree.
That's absolutely a true statement. It was the key to make all the other things function.
Yeah. So
for me,
disease modification is what my whole goal is with this treatment.
Yes.
And the fact that it helps people to live like you are.
And live better lives.
That's the cream on the top.
Yep. Cherry on the top.
Cherry on the top.
There you go. All good.
Well, Dave, thanks for being my patient. Thanks for being in my practice and taking some time. I love hearing that story.
It's a great story, and I'm living it.
It's a great story.
I'll share it all the time. Thanks.
Thanks.
Good to have you.
Yeah.